Many things can impact a person's overall health. What we eat, where we live, transportation, social engagement, family support, and the list goes on. Not having a sense of security can cause stress, and even more so during the holidays. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. Today we're talking about what we call social drivers of health and the resources available to the community. With me today is Kristin Repp. She's the Director of Population Health with St. Luke's Health System. Thank you so much for joining us.
Thanks so much for having me.
So first of all, can you explain what are social drivers of health?
Sure. Yeah. Social drivers of health, they really are just those factors that influence health outcomes, put really simply. And so they're everything from the places that we're born into, where we live, where we work, where we play, all those kinds of things that can really shape, kind of your daily life and your ability to be healthy and well.
Okay. Now in 2022, St. Luke's started a social drivers of health survey that every patient's given when they see a provider. Why might a medical provider ask about a person's needs?
Sure. Yeah, I think that may not be totally obvious on the surface, but it really is part of really caring about the whole person. So whole person care says we really want to make sure we have a care plan that matches you and matches your lifestyle and what you're able to do and that you have that best health outcome. And so it might mean, if I have a chronic condition like diabetes and your care plan is to eat lots of fresh foods, do you have access to those fresh foods? Or what about transportation and being able to get to your appointment? So you can see how those things might really affect your ability to be healthy and well. And if our goal is to work together to that best health plan, we want to know that information to help you be successful.
Absolutely. Okay. So how important is it that a patient fills out that survey honestly?
Yeah, we know that we're really asking people to be vulnerable with that type of information. And so we take that really seriously. It's really important, though, because there's so many great resources in our community. And if we can help connect the dots and share with our patients a great place to get help with help that they need, then we really want to be able to do that.
Okay. Now, once a patient fills out that survey and says they would like to be contacted, what's the next step?
Yeah, so a couple of things. So we're asking basic questions, right? Like food, housing, transportation, social connection. But we're also asking a really important question about, do you want help finding resources? And so we really want to honor that. So if people say, yes, I really would like some help navigating resources, then sometimes we have someone available right then and there that is able to help connect those dots for you. Sometimes people are wanting to self-navigate resources, and that's okay too. And we really respect that and wouldn't want to reach out to that person. But getting that data about how many people are experiencing those types of issues can really help us on a community-wide level. So an example of that might be transportation. So we can work together in the community, whether it's reaching out to KCTA or find grant funding, or just work together in collaboration with other community members to try and solve maybe a bigger issue.
Okay. So where can people go for support and resources, even if they're not a St. Luke's patient?
Right. So we have a website that's available, stlukesresources.org. So you can go on that website and self-navigate. You can type in your zip code and find what you need in your area. Everything from food pantries to childcare to legal assistance, all kinds of things. We know this is the holiday times too, and so maybe you're looking for something specific to help you get through the holidays. And so all that information is there and able for you to search up.
And how does addressing these needs help provide more equitable care for patients?
Sure. So, I think the COVID-19 pandemic taught us a lot. It shined a light on health equity, which was, I think, much needed in our community and around the world. But what we know is that SDOH needs, they really disproportionately affect certain populations. So whether it's certain socioeconomic groups, certain minority groups, our older adults, different zip codes in our city, we really don't have the same access to all the same things. And so what we want is everybody to have that true, fair opportunity to have the best health outcome that they really can have.
Absolutely. Well, is there anything else you'd like to add?
Yeah, I think the most important thing is this isn't just a St. Luke's conversation. This is a community-wide conversation, and it's so fun to see the energy in the community really rallying around this idea and the collaborations that are happening with our community partners. They're really the ones doing the hard work in the community, supporting our neighbors and patients. So we're just kind of the dot connector, and so really proud to get to work with all those community partners.
Well, Kristin, thank you so much for joining us again.
Yeah, thank you so much for having me. I think it's such an important topic, especially around the holidays.
Absolutely. To learn more about community resources, visit stlukesresources.org. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.